ठीक है जो कैसे क्या है क्या काम है नहीं ये कैसे नहीं हाँ ठीक है नहीं हाँ आज मैं एकत्र आहे एकदम just little introduction. तो बस सर ठीक है सर अभी आपको मिलेंगे हाँ ये पण ठेवून घ्या
A very good morning, sir, to all the eminent doctors. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila through its innovation to serve the society and humankind. The topic of the webinar is dosage reduction strategy in rabies management and role of novel vaccine. Dear doctors, rabies is the world's first novel three-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch, with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded, and no case of ADS was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. Arun Patil, sir, specialty MS surgeon, and have total 45 years of experience. And now I would like to request Dr. Arun Patil, sir, to initiate the talk, and later on we will have question and answer session. All the participants can drop their questions in the drop box, and we will read out it after the presentation. Dr. Arun Patil, sir, the session is over to you. Thank you.
hello hello good
Yes, sir, you
morning
are audible. Yes, sir,
yeah,
you are audible.
rabies is an age-old problem and I think repeat patient very few of the new generation doctors might have seen I suppose but we had seen many rabies patients was just in front of her. So this come was in need of time. And we welcome this on the other issue, G protein. This is simplified and hardly any reactions. So let's have opinions. Hello. Hello.
Yes, sir.
Doses of vaccines, rabies, have started right from 7 vaccines, 10 vaccines, which were and that too sub on the in the subcute on the over the abdominal scheme base. But now it has come down to 3 doses, which is a welcome phenomena. And 14 vaccines we used to take initially. And that also in many government hospitals, it was not available. That was everyday story because people used to go there and there was no vaccine. and now 7 vaccines, these rabies vaccines, and now this has come to 3 doses. I think the compliance would be the best because dogs are there. I think till the stray dogs are there, most of the time, till the stray dogs are there, rabies will be there in the world. Any experience of others? Many times what happens, we go for movie in the night and go come walking to our house. So every lane, there is a batch of dogs waiting for us. And if you don't become friendly with them, chances of biting are more. So I think that's why I think rabies in a sense, dog bite. Dogs bite have become common, and as such, the statistics is 69,000 rabies deaths in a year in India. Is it says speaks truth. Three doses. Okay. And figure what I am looking at is there are two sides of mountains with a vaccine in between, the bridge. And these dogs, of course, are good when they are in house and when they are not rabid. But the bridge between them is this vaccine. And this is G protein vaccine, which is very safe. And we have been giving
Hello.
slides. Actually, globally, we can see about 59,000 human deaths occurring. And out of that, I think 20,000 in a year are from India. And this is alarming. 91% deaths in India occurred in the rural area. Rural area is very common. Maybe that they don't take treatment. Next slide. As you get a bite, dog bite, I think the local treatment immediately is very important, and active and passive immunization. Uh, this immunization is available at the centers in the town, and that's why in the rural areas these cases are more because they are not available treatment. Initially, this was 5 doses treatment, and so patient has to come 5 times, and that was 0, 3, 7, 14, and 28 after the exposure to the rabies. Next slide, please. Next slide. Rabies post-exposure. So current challenges are one is non-compliance, because even for going for 7 times, patients avoid after few days. They might take a dose or two. And secondly is the current vaccine which is available are cell culture, and this is inactivated vaccine are for last 50 years old, more than that. And in consistency, potency, stability wise, there was problem. These are the current challenges. Next slide, please. So compliance. We have to see the full doses, full course of ARV, anti-rabies vaccine, uh, should be given to every patient. And those uh, patients not taking within 60 days were deviated from the scheduled regimen. And lastly, those who have at least 1 dose of ARV, but not completed the scheduled doses. The three compliance wise, we can categorize these three. Next slide. Yes. Non-compliance 5 doses. This is another proven cause of death. Because take 1 doses and forget, and then they land up in the trouble. So there's this statistics you can see the outcome of non-compliance in different patients of different age. The reason of deaths may be due to lack of administration of rabies immunoglobulin or poor compliance to vaccine. This is just a statistical data. Or this was the article, I think, in Journal of Family Medicines and compliance to the post-exposure prophylaxis. among animal bite patients, a hospital-based epidemiological survey at Safdarjung Hospital, and that was 48%, 53% were non-compliant to the full course of ARV. Few are delayed compliance, but majority are 53% are non-compliant. Next slide, please. Compliance to anti-rabies vaccine in post-exposure. In municipal hospital in Bangalore, the compliance rate of intramuscular rabies vaccines was 60%. So this is slightly improved, but it is 60%. Okay. Next slide. Major constraint for compliance to complete ARV was loss of wages. That was an observation. And but mostly people, according to our they forget after 1 or 2, 3 vaccines. Of course, they got a pamphlet, the dates are written, and there are many things like into school timings, then distance of the hospital from the home, then cost and loss of wages. But loss of wages because the vaccines is slightly costlier. Next slide. So let us see the evolution of rabies vaccine and live attenuated vaccine that started in 1885, and an inactivated vaccine started in 1911. And now we can see this cellular 1976 inactivated vaccine cell culture, standardized immunogenicity. These are lyophilized, and this is powder form, and you have to prepare the injection. Next slide. Because of the non-compliance, from 31 doses to 5 doses, and now it is 3. Novel 3-dose recombinant vaccine is G protein vaccine. First vaccine, and this is recombinant rabies G protein vaccine, and prepare first protein, then prepared by VLP platform. This is how it is manufactured, and the first dose 0, next is third day, and third dose is 7th day. So this is very better compliance, convenient, and ready to use, and no powder form. Directly you can give, and I think even the dose is half cc, not a 1 cc. Next slide, please. This is that VLF technology we are showing, because G protein is difficult to stabilize. But in this vaccine, they have manufactured and a strong humoral and cellular response from this G protein, and it's a very stable vaccine. You can see the chart. And clinical study phase 3 shows safety and immunogenicity of the novel 3-dose vaccine. This is recombinant nanoparticle rabies G protein vaccine, administered as a stipulated post-exposure period, and multi-center phase 3 clinical study has been done on that. Phase 3 studies shows that regime 037 is better than the 5 days regime. Then and 533 subjects were tried as compared to 267 subjects. And so to this randomized comparative controlled multicentric study itself speaks the compliance is good and results are also good. Next slide. So efficacy wise, it's definitely good because the study shows it's 98%, and safety, no problem, it is good, and it is prepared, ready manufactured, prepared vaccine. It's less adverse effects. All three was found to be safe, immunogenic, and was compared to 5 doses, and it's non-inferior to any of the reference vaccines. It is one of the best vaccine.
Doctor, if any Doctor, you have any question, please ask.
हेलो हेलो सर, मेरी आवाज आ रही है? सर आप म्यूट है, आपकी आवाज नहीं आ रही है। हेलो।
हाँ
सर
unmute
कुछ
आती है अभी?
कॉमन सर कुछ कॉमन क्वेश्चंस सबके माइंड में जो रहते हैं, एक तो ये रहता है कि रेबीज होता किस चीज से, लाइक कौन कौन से एनिमल बाइट्स हैं जिससे रेबीज के चांसेस रहते हैं। एक ये बहुत कॉमन क्वेश्चन है जो पूछा जाता है।
हाँ 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 हाँ. Common is this vaccine is good for all four-legged.
ठीक है सर।
Hello. Okay. And we can say rabies is a preventable viral disease, and rabies virus infects the CNS and causes disease in the brain. That is, rabies is 100% fatal, worst disease, and there is no effective treatment for the rabies. So rabies virus is primarily transmitted from the rabid animal's saliva when it bites or scratches someone and licks to the wound or grazed and broken skin or to the lining of the mouth and nose can also transmit the disease. And dogs, I think, are 96% responsible for this human rabies cases. And this is how it is transmitted. Commonly is dog. Second, I think, question in the mind for the many people is, how does one treat the animal bite? If the person is bitten by an animal, first, as we saw in the slide, it should be washed immediately thoroughly with the soap water and or flush the water, whatever the situation is. First, what is important is first aid treatment, and wound should be cleaned thoroughly with uh, alcohol. Or nowadays, sanitizer is available at many places, and iodine. And then it should be the patient should go to the nearest healthcare unit. These are the primary first aid treatment for the rabies patient when the bite is there. Any dog bite is there, and you have to observe the dog also. Any questions? Commonly found. Hello. Hmm. There are many doubts in the hello. There are many doubts in the minds of people. What are the limitations of the ARB? And limitations are complete post-exposure prophylaxis is necessary to prevent rabies among all animal bites, as we say, four-legged animals. It is essential for the bite limits to complete the full course of vaccination as recommended for the complete protection. This is very important. And the compliance to anti-rabies vaccination post-exposure prophylaxis is, as we have seen in the slide, it is only 60%. So this is a matter of concern, as animal bite victims who do not complete the full course are still at the risk of developing rabies. Now we'll say what are the benefits of this novel three-dose vaccine. The novel three-dose recombinant rabies G protein vaccine, we usually give 0, 3, and 7 days, was found to be safe, best compliance, best immunogenicity, and was compared to 5 doses WHO pre-qualified vaccine in stipulated post-exposure prophylaxis cases. The reduced number of vaccine doses leads to reduction in number of visits and travel cost, as well as increases the compliance, which is important to prevent rabies and ultimately help in eliminating dog-mediated human rabies. So the target by 2030 is to eliminate the human rabies.
Thank you so much, sir, for the informative talk. We truly appreciate your efforts, sir. Last but not the least, we'd like to inform you that Rabies has won two prestigious awards in innovative category, ET India Pharma Award and Golden Globe Tiger Awards. Thank you so much, sir, for your appreciation.
Thank you. Thank you.
Tech support, the session is completed. Please, we can conclude the session.
Okay.